Good morning, folks. Just give us a second while we confirm the stream. Sergeant Lugo, the stream's been confirmed. You can start your opening.
Thank you. Good morning, everyone. Welcome to today's remote New York City Council hearing of the Committee on Civil Service and Labor. At this time, would all panelists please turn on your videos? To minimize disruption, please place electronic devices to vibrate or silent. If you wish to submit testimony, you may send it to testimony@council.nyc.gov. Again, that's testimony@council.nyc.gov. Thank you for your cooperation. Chair De La Rosa, we are ready to begin.
Good morning, and I am Council Member Carmen De La Rosa, Chair of the New York City Committee on Civil Service and Labor. First, I'd like to acknowledge that we've been joined by Council Member Crystal Hudson, Chair of the New York City's Council's Committee on Aging. I will also like to acknowledge that my other colleagues who have joined us so far today, Council Member Caban, welcome, and thank you all for being here. I am Councilmember De La Rosa, and I'm proud to chair this Civil Service and Labor Committee today. We will be hearing resolution number 24 of 2022, sponsored by Councilmember Crystal Hudson, which calls for the New York State Legislature to pass and the governor to sign the Fair Pay for Home Care Act. This legislation would ensure that home care workers are paid uniform and fair wages across the state. In recent years, the aging population and the increasing desire among the elderly and those with disabilities for at-home care have combined to generate an explosive growth in demand for home care workers. In New York State, the number of home health aid and personal care jobs is projected to rise from 440,000 in 2018 to over 700,000 by 2028. Driven by employment in home care agencies, private households, and public programs like the Medicare Consumer Directed Personal Assistance Program. High turnover adds to the problem. Employers across the state need to recruit an average of 26,510 new aides each year simply to keep up with the growing demand for care, as well as an additional 71,680 workers each year to replace the thousands of aides who leave these occupations or exit the labor force entirely. In total, over a 10-year period from 2018 to 2028, nearly 1 million job positions will be filled to meet the demand for home care aides. The demand for home care workers, aides who work in private homes already exceeds the supply. A 2018-2019 statewide survey of home care agencies found that on average, 70% of home care positions were left unfilled due to staff shortages. Because home care work is typically poorly paid, as well as physically and emotionally stressful, it is difficult to recruit new workers and retain existing ones. The COVID-19 pandemic has increased the demand for home care even more, while further depressing the labor supply. Home care allows vulnerable community members to remain living at home with dignity and high quality individualized care. Many immigrant seniors and families prefer home care because they can receive language accessible and culturally competent care that they would not find in institutionalized settings. While it is crucial to examine the needs of older adults and the programs that allow for them to age in place, we must also ensure that the workers providing these services are supported as well. It is time that we invest in home care workers to ensure that these workers can earn wages that properly compensate them for the skilled and important work that they do. For New York's home care workers, the most pressing issue is inadequate pay and a lack of benefits. A significant number of home care workers rely on public assistance to go without health insurance coverage despite working full-time or multiple jobs. Other concerns commonly cited by home care workers include a stressful, complex, and high-risk work environments, failure to receive full pay for all hours worked, inconsistent work schedules, and fluctuating income, and a lack of opportunities for career advancement, promotions, and raises. Home care is mostly provided by immigrant and women of color. As we examine the challenges facing this industry, I would like to take the opportunity to uplift my own mother's story. She worked as a home health aide for most of her life. I saw firsthand the emotional and physical toll the job took on her while making poverty wages that were insufficient to put food on the table for our own family. My mother worked as a home health aide for 25 years, only being able to retire once I was elected to office. Despite poor wages and grueling work, I know my mother and the thousands of home care workers in New York State lead with their hearts. Their patients become part of our own families, spending holidays and birthdays with us. After years of backbreaking work, home care workers deserve to be fairly compensated. And this year, we can finally achieve this in New York State. Today's my mother's birthday, and I hope we can give her and her colleagues who remain in the field good news this year. Confronting the challenges affecting the state's home care industry will require transformative solutions, including large-scale improvements in home care worker compensation and public funding for wage increases and health coverage. The committee looks forward to receiving recommendations and feedback on resolution number 24 of 2022. The committee is also interested in learning how the City Council can work with city and state partners to better support home care workers. I would like to take this opportunity to thank the committee staff for their hard work in putting today's hearing together. Committee Counsel Bianca Vitali and Policy Analyst Elizabeth Arts. I would also like to thank my own staff, Chief of Staff James Burke, Legislative Director Kiana Diaz, and Communications Director Amelia Eberline. I would now like to turn it over to Councilmember Hudson for her remarks and thank her for her extraordinary leadership. Councilmember Hudson.
Thank you so much, Chair De La Rosa, and a very, very happy birthday to your mother, Carmen. Thank you again, Chair De La Rosa and members of the Committee on Civil Service and Labor. I'm Crystal Hudson, and today I'm honored that the Committee on Civil Service and Labor will hear my resolution calling on the state legislature to pass and the governor to sign the Fair Pay for Home Care Act, especially when both houses of the state legislature have included it in their one-house budget bills, and advocates are pressing Governor Hochul to include it in her final state budget. This resolution was the first piece of legislation I introduced as a member of the New York City Council, and that's because it was, and it is, so very personal to me, as this is also for Chair De La Rosa. I was raised as the only child of a single mother, Carol Hudson. When she was diagnosed with Alzheimer's disease, I quickly and unexpectedly became her primary caregiver, moving back home and leaving a promising career in sports marketing to care for her. My mother spent more than 40 years working as a nurse in New York City. Yet when it was time to provide her with care, I realized just how difficult it was to navigate the bureaucratic systems in place that purport to help folks obtain support, yet in reality further confuse them and leave them feeling defeated. I entered into public service because I was determined to ensure that no one would have to experience the challenges that my family did when my mother got sick. Thankfully, I was fortunate to have the best care in two women, Paula and Carol, not dissimilar from Chair De La Rosa's own mother, Carmen. They left their homes every day to come to ours. They loved my mother as their own, and they provided world-class care under difficult circumstances. Everyone who needs home care deserves their own Paula and Carol and Carmen. Yet the meager wages, long hours, and unpredictable schedules make it difficult to retain workers, many of whom would rather find another job than deal with the inequities in home care. These wages further entrench the gender pay gap, as most home care workers are women, people of color, and immigrants. We must act quickly, or New York will continue to have the worst home care shortage in the nation, while our state's population of older adults rapidly expands. The Fair Pay for Home Care Act will require home care workers to be paid a minimum of 150% of the regional minimum wage, which would equate to $22.50 an hour in New York City, up from $15.93 per hour. It will help alleviate poverty for home care workers, chip away at the gender wage gap, attract more home care workers, and boost our state's economy with more income tax revenue and reduced public assistance roles. I urge this committee to pass this resolution so we can show our state's 400,000 home care workers that we hear them, we respect them, and we know it's time to pay them the wages they deserve. Thank you. And I would just like to apologize in advance. I have to run off to another meeting. Normally I would stay to hear the panels, but I do plan on watching this afterwards. And so thank you in advance to everyone who's going to be here testifying. And thank you again, Chair De La Rosa. Thank you to the committee members and thank you to the staff.
Thank you, Councilmember Hudson, for your testimony. I'd also like to acknowledge that we've been joined by Council Members Moya, Bachar, Nurse, and Joseph. Thank you for joining, colleagues. I am now going to pass it over to our policy analyst, Elizabeth Arts, to go over some procedures and some protocols for today.
Thank you, Chair. My name is Elizabeth Arts, and I'm the policy analyst for the Committee on Civil Service and Labor for the New York City Council. Before we begin, I want to remind everyone that you will be on mute until you are called on to testify, when you will be unmuted by the host. At today's hearing, members of the public will give testimony followed by council member questions. I will be calling on panelists to testify one at a time. Please listen for your name to be called, and I will be periodically announcing who the next panelist will be. For everyone testifying today, please note that there may be a few seconds of delay before you are unmuted, and we thank you in advance for your patience. All hearing participants should submit written testimony to testimony@council.nyc.gov. Council members who have questions for a particular panelist should use the raise hand function in Zoom, and I will call on you after the panelist has completed their testimony. I will now call on members of the public to testify. Each panelist will be given 5 minutes to speak. For panelists, please wait a brief moment for the Sergeant at Arms to announce that you may begin before starting your testimony. I would like to now welcome to testify Iris Smith, Edwin Torres, and Bobby Sackman. I will be calling on you in that order. The Sergeant will cue the panelists to speak and start the timer. Iris Smith, you may begin.
Time starts.
Thank you. Good morning, everyone. My name is Iris Smith. I'm a home care worker, and I'm happy to be here to give my testimony. And happy birthday to Miss De La Rosa's mother, Mrs. Carmen. Why should we give home care workers a fair pay wage? Home care workers are frontline essential workers. We provide care that makes it possible for seniors and the disabled to maintain their dignity and respect in their homes and a safe environment where they can thrive. Home care workers prevent their clients from many trips to the emergency room, admission to the hospitals, and long-term care facilities, which can create a financial burden on the health system. Right now, there is a shortage of home care workers. Home care workers are disappearing because they simply cannot afford to do the work. It's a financial challenge for us to pay rent, to buy food for our family, or to pay the multiple train and bus fares just to get to work. We are frontline essential workers. We are out there during inclement weather, rain, sleet, or snow. We're like the post office carrier. We deliver services. We provide those services during blackouts, before the pandemic, and we will continue to provide service after the pandemic. It's time for home care workers to be acknowledged, respected, and supported. So that's why it's important for us to receive that fair pay wage. It would say that the work that you do is worth it. It would say that they respect us. So we're asking Governor Hochul to include us in that budget for this year for that permanent wage, because we have home care workers have to work over 130 hours just to keep our health and benefits. And it's not fair to us. It's like we're doing more work and we're getting less pay. And the work that we do, we love it. We love this work. We love providing care. It's not for everybody, but it's for the people who really care about people, and we care. So it's only fair that the governor showed that she cares about the work that we do by providing that permanent raise to us. Thank you for allowing me to share and being here this morning. Thank you so much.
I will now turn it over to Edwin Torres for his public testimony. You may
Time-
begin.
Time starts.
Hello, my name is Edwin Torres. I am a home worker, the very few men that does this kind of job. I've been doing it about 6 years already. But first of all, I am a husband, I'm a father, and I'm a grandfather. My testimony comes from something personally. In March of 2020, I had brought my father-in-law to live with us during the pandemic. 2 weeks later, I have to take him to the hospital. That same week, I take my wife. I took my father-in-law on a Tuesday. I took my wife on the Thursday. That Saturday, her father passed away. The saddest thing about this was that she was one room next to him and heard his last scream of life, and she couldn't stand up and hold his hand. And what I used to do at night was pray to God to let her get through this, and ask her father not to take her away from me, to keep an eye on her. The thing that this pandemic did, the only thing that kept me really going was that I had to be here for my children, my grandchildren, and for the people that I take care of on the daily basis, because I know a lot of them had nobody, and they felt lonely as I felt lonely during that period of time through COVID. Today, my wife still suffers from, she's called a long hauler. She has heart issues, blurry mind. She's also a healthcare worker. She's a certified medical assistant and a pharmacy tech. Life hasn't been easy for us. I'm still struggling with my finances because I really can't make the money that I should be making to pay my bills and feed my family. So what I am imploring to Governor Hochul is to pass this fair pay bill, because it's so important to us, because we give those dignity that we take care of, but where's our sense of dignity as workers, as home care workers? So, you know, if we hit one of these pandemics again, there's going to be such a crisis in the home care that is going to be horrible. There's not going to be no home care workers, because from my own, I've heard from other testimonies that if this happens again, a lot of people are going to leave their jobs, as they're doing right now. Because I had to pay $25 a box for gloves, $3 each for a surgical mask, and I was making nothing. I was barely surviving, like I'm still surviving today. So on this panel, I know you guys had heard it all, but this is something that I take very personally. My grandmother did this over 30 years. I could be doing anything else. I'm a man of many trades, but I do this because I enjoy it. I have passion for it. So please try to get this through to Governor Hochul to pass this fair pay bill. Thank you.
Thank you for your testimony. Last witness on this panel, I'd like to turn it over to Bobby Sackman. You may begin.
Ms. Sackman, your clock is ready.
Hi, good morning, everybody. Thank you, Assemblywoman De La Rosa, and certainly happy birthday to your mom. You've been a care champion when you were in Albany, and now it's City Council, and thank you for everybody attending. Also, Ms. Smith and Mr. Torres, thank you for your testimonies, because you're why we're doing this. My name is Bobby Sackman. Some of you may know that for 28 years, I was the Director of Public Policy with Live On New York. Caitlin Andrews, who is here, is my wonderful successor. I have been working with the New York Caring Majority for a few years, but intensely this past year, to get fair pay for home care into the final state budget this year. As you may know, we did successfully get it into the one house Assembly and Senate bills, which is an enormous accomplishment. And now we're just, waiting for Governor Hochul, who, as you've heard before, has suggested a bonus that would make no difference in a home care worker's life. And we want it to be sustainable wages. So I'm not reading, I submitted testimony, but I'm not going to read it. The New York caring majority is comprised of older adults, people with disabilities, family caregivers, and home care workers. And even though this is, a state-funded issue because it's basically Medicaid, it is so important to the lifeblood of New York City. We need care across the generations. And what doesn't get publicized as much is how many family caregivers, usually the woman, they have said that the best long-term care insurance is having a daughter. Many women leave their jobs to care for their parents or other older relatives. And they have a horrible time trying to get back into the workforce. It's that continuization, if that's a word, continuity of feminization of poverty. And this is one of the cycles we're looking to break. We're paying low wages to the women workers. Mr. Torres, you are the rare man. It's mostly women of color and immigrant women, and then family caregivers. These women can't get ahead in their own careers. And that's why we need this done. What you could help us with is go to your local state representatives from your districts right now, especially in the Bronx, as you know, that's where Mr. Hasty is. And ask and just make sure that they support the bill. Many have. We have 96 assembly members and 43 senators, but they need to speak up. Albany is known for things falling off the table in the midnight hour. You could really help us with that. We have horrible stories of people with disabilities sleeping in wheelchairs because they can't get home care night after night. Somebody I just saw that I know on Twitter did this for a year, sleeping in a wheelchair because they can't get in and out of bed. We have older adults who fall in bathtubs because they don't have help. And if you break your hip, 1 out of 4 die within a year. This is very serious. And then family caregivers, who I mentioned, are just stretched to the hilt. So we're an aging society. COVID is bringing more people on with disability, again, as Mr. Torres pointed out, and I wish your wife the best. And what I do want to add, because I'd be remiss, is fund the Department for the Aging, because it's so connected to this. The case management wait lists that, of course, I worked on for many years, but the case management wait list is wait list for home care because it's not an entitlement. But these are seniors that also need this care. And this is where you can play a direct role in the current budget process. And look at how the Department for the Aging, as I've heard Councilwoman Hudson say before, gets them less than 0.5% of the whole city budget. We're 1.7 million people over the age of 60 in New York City. That's bigger than the whole city of Philadelphia, the whole city. And we are growing. So please, you have a very direct role. There's Meals on Wheels, there's a senior centers to keep people independent. And that's where you can really play a role. And I hope, of course, that you pass this resolution. The clock is ticking. We know that it's close to the end of the Albany budget process, that you can get it to your state colleagues as quickly as possible. Thank you so much, everybody, for your attention and caring about. We want to make this a caring economy. Thank you so much.
Thank you for your testimony. I will now turn it over to Chair De La Rosa for questions.
Thank you so much. I also want to acknowledge we've been joined by Councilmember Feliz. And I have a question first to Iris and Edwin. Thank you for sharing your stories. So many parallels to, some of the challenges I saw my mom experience. But I wanted to ask you both, whoever wants to answer the question, can you talk specifically about the pandemic and some of the risks that you endured during the pandemic?
Oh yes, the risk that I suffered was going out every day to a client's home. Like getting PPE was hard. It was horrible. Nobody gave us money from that. It came out of our pockets. I mean, every time I went into your house, I had to put my cover shoes on, my mask, and worrying that once I got home, I had to take everything off and make sure that I didn't bring this virus home, because 23 days later, after my wife got home, I had to disinfect this house completely. So my fear was bringing this back and see her go through this thing all over again. It was very challenging. It was scared. Today, I'm still scared about going to work and coming home, doing that. My wife is here now. So it is scary. This virus is not over. And God, I pray to God that it doesn't happen again, because if this happens again, it's going to be, I would say it's going to be the worst thing that ever happened again to us.
Thank you so much for sharing. Iris, go ahead.
My situation was similar to Edwin's. I have a son at home who has chronic asthma, and my fear was that going into work, contracting the COVID-19, and then coming home, where would I quarantine? Because we were not provided that service where you could go stay at a hospital and until the COVID passed. And so I still went out to work every day because I had to provide food and pay rent during the pandemic. So I went out there with fear every day, you know, that I could contract this and bring it home. But I knew that I had a client that depended on me. They didn't have anyone else. And so I had to go, but it weighed in my mind, will I bring this home to my son, and like Edwin said, the PPEs, paying for gloves, you had to pay for your gloves, pay for masks, and they were not cheap, just to protect yourself, your client, and your family. So it was really hard. It was challenging, but as home care workers, when we step out there, we answer the call. So it was challenging, and thank you for allowing me to share.
Thank you, Iris. And Bobby, I have a few questions for you if you are willing to answer some of them. Can you talk a little bit about the factors that have led to the staffing shortage, as well as how many seniors in New York City, for example, do you know how many are on waiting lists for care or have been denied?
Well, the factors that have led is sort of what's been said, and it's poverty level wages. Outside of New York City, north of Westchester, home care workers get $13.20 an hour. They're not even eligible for the regional minimum wage, which is $15 an hour upstate. Here in New York City, it's the $15, but we know very well how hard it is to even live on $15 an hour. And there are other opportunities now. Targets may pay more. You can go to McDonald's and earn more. And as Mr. Torres pointed out, there's a reason that people do this work, because they really love it. Love is great, but they need money to pay the rent and just live with dignity. I also want to point out one more thing, I guess, to your other question. In my testimony, there's something at the very end, if you want to look at it, and it's called a comprehensive skills table. In the Caring Majority Coalition, we have RNs, we have people with disabilities, family caregivers, older adults. Some of those folks, not me, put together this skills table. It just goes on and on. This is not babysitting. Mm-hmm. This is, of course, getting nutritious food, and as we said, making sure the personal care, but this could be wound care. Your skin could really deteriorate if you don't get proper wound care. This could be respiratory care. Maybe you need a ventilator of some kind. And then we're talking about COVID. This is help getting in out of the bed, which is very physical labor, but also you have to be careful. These are fragile people that you're serving. So it just goes on and on. Home care is health care. And I think that's what's not been recognized. And we know that there are people who can't get out of a nursing home, or whether they're in a nursing home long-term or a nursing home for rehab or a hospital, they get delayed because there's no home care worker. There's nobody to send them home to, or they get sent home and there's nobody to send them home to. There are 80-year-old women taking care of their 90-year-old husbands with dementia throughout the night, who then need their own medical care. This is not a system. This is neglect. This is poverty wages and neglect. In terms of numbers specifically for New York City, I'm sorry that I actually don't have those numbers. And in terms, I could try to get them. I could ask, I certainly will. In terms of waiting list numbers, I don't know if you're referring, I know I mentioned DFTA, to the ISEP program. and frankly, I think maybe, I don't know, Caitlin, if you have some numbers, if you want to share that today, I think she might know. What I can tell you is in my 28 city budgets that I sat through and lobbied through, case management and home care and DFTA funded programs, but case management, home care in particular, always over 28 years have had waiting lists. And we have an ever growing aging population. You can see I've aged into my own field. I'm glad to be here. So we have a structural problem. It's a funding problem first, but it's also a structural problem. How does the city structurally fund these services? Because we know we're not keeping up. So I'm sorry, I will go back and see if I can find out any other data for you on that question.
Great. And then my last question for you before I turn it over to the colleagues here is talk to us about this bonus that the governor has announced with the goal of alleviating the plight of the home care workers. You said in your testimony that the bonus won't help. Can you explain why?
Sure. There's about $630 million of federal money, the American Rescue Act money. And that's the exact amount of money, that's the amount of money that is now in the Senate and the Assembly bills. So the fair pay for home care would begin in January of 23. So the last quarter of the state fiscal year, that money covers it. That money launches this program. And there's a CUNY study, there's a link in my testimony, you might have heard about it, that has shown if you make these economic investments, the return on investment is literally hundreds of thousands of jobs across the state and certainly in New York City. And these are folks that spend the money locally. So it will generate the money. What a bonus does, and the governor wants to use this with that same money, and the max is $3,000. Home care worker will probably get a pittance of that anyway. If you're earning poverty level wages, what's a bonus going to do? In fact, when the bonus disappears, which is quickly, it's like getting a pay cut. This will not recruit or retain the staff. I think Governor Hochul meant it as a thank you, again, for the work during COVID. But the real thank you is a living, sustainable wage. So the bonus is just not a good use of this funding. It's a lost opportunity.
Great. I could not agree with you more on that. A big thank you is a living wage that is sustainable and lifts our families up. I want to recognize that we've been joined by Council Member Hanks. Thank you for joining us. And I want to see if any of the colleagues have questions. Please raise your hand so we can call on you for this panel.
Thanks, Chair. I will now call on council members in the order they have raised the Zoom hand function. If you would like to ask a question, you have not yet used the Zoom raise hand function, please do so now. Council members, please keep your questions to 5 minutes. The Sergeant at Arms will keep a timer and will let you know when your time is up. You should begin once I have called on you and the Sergeant has announced that you may begin. Let's see. I don't see any council member questions. So we will move to the next panel. I would like to now welcome Wayne Ho, followed by Tara Klein, followed by Lorraine Sullivan. Wayne Ho, you may begin when the Sergeant cues the timer.
Mr. Wayne Ho, your clock is ready.
Great. Thank you very much. My name is Wayne Ho, and I'm the president and CEO of the Chinese American Planning Council, as well as our subsidiary, the Chinese American Planning Council Home Attendant Program, Inc. I want to thank Chair De La Rosa, as well as Councilmember Hudson and the other council members who are part of this committee for joining us today. I am here to speak in support of Reso 0024 in support of fair pay for home care. CPC HAP was licensed in 1998 as a licensed home care agency, and we are a 100% Medicaid funded home care agency, nonprofit home care agency. Every year we serve about 3,000 clients with our 4,500 workers who we all see as essential. We are also part of the community-based home care working group, which consists of 11 nonprofit home care agencies that serve about 11,000 New Yorkers and employ about 14,000 New Yorkers. And just this past Friday, outside the governor's office, we organized the Providers for Fair Pay rally, where we had about 150 workers, clients, and allies join us. The CPC Home Attendant Program has received a rating of 8 out of 10 in home care worker satisfaction based on our most recent annual anonymous worker survey. And the majority of our home care workers have been with us for between 5 to 10 years, which we understand is higher than the average in this industry. So we value our essential workers before the pandemic, throughout the pandemic, and now as we recover. Unfortunately, we are a 100% Medicaid funded home care agency, which means that we are subject to all Medicaid rules and regulations, which limit our ability to compensate our workers well. The fellow panelist, Bobby Sackman, mentioned that this is a funding issue, and we need to see an investment into this sector to make sure it's a more caring economy and quality jobs, not only for our workers, but it will lead to stronger services and more consistent services for New Yorkers who receive home care, who are mostly seniors or individuals across age groups with disabilities. In the past fiscal year, CPC HAP spent $2.7 million in overtime, interruptions during 24-hour cases, transportation, PPE, and more for our workers. And this $2.7 million was not reimbursed to the agency. We actually ended the last fiscal year with a deficit. Nonprofit home care agencies like CPC HAP, while we are in full compliance with very complicated federal, state, and city regulations, especially Medicaid regulations on compensation, as well as labor laws and wage laws, we recognize we're accountable not only to the state, but we are also accountable to our workers and to our clients. And that's the reason why we are in full support of fair pay for home care. It will raise our home care worker wages to 150% of minimum wage. We encourage the governor to adopt the Assembly and Senate One House bills that has put in the funding for fair pay for home care. And we recognize once again that one-time bonuses are not fair and do not address the systemic issue for our workers. We already know that this is not going to help out the workers permanently, and it won't address the turnover and the home care shortage. Fair pay for home care makes philosophical sense. We want to pay our workers 50% more for the jobs that they're doing, which are essential. Programmatically, it will ensure continuous care for our seniors and our disabled. Operationally, it will address the workforce challenge that we're facing in home care. And fiscally, it makes sense because it generates $6 billion in economic activity for the state of New York alone. We recognize that fair pay for home care is just one step in reforming our home care system. We also need to pass the Epstein and Prasad bill to convert 24-hour home care cases into 2 12-hour split shifts. We need to support the New York Health Act. We also need to end the Medicaid global cap, so there is an investment in care for everyone who needs it. At the city level, we'd like to see Human Resources Administration authorize more cases. We also like to see more city tax levy dollars to supplement cases and wages, training programs, career ladders for our workers, as well as funding innovation. So I want to thank you, this committee, for supporting our workers who are mostly immigrants and women of color. We need a just, dignified economy for our workers. We also need to make sure our patients continue to receive quality care and can age with dignity in their own homes. Thank you.
Thank you. I will now turn it over to Tara Klein. You may begin when the sergeant starts your clock.
Ms. Klein, your clock is ready.
Great. Thank you, Chair De La Rosa, for advancing this resolution today in support of the Fair Pay for Home Care Act, and to Councilmember Hudson for bringing it forward, and all the other council members here today. My name is Tara Klein, and I am a senior policy analyst with United Neighborhood Houses. UNH is a policy and social change organization representing 45 neighborhood settlement houses across New York State, including 40 here in New York City, that reach over 765,000 New Yorkers from all walks of life. 3 of our UNH member organizations provide nonprofit home care services to their communities as state licensed home care services agencies. Together, every year, these settlement houses provide services to thousands of individuals with nearly 7,500 workers throughout New York. While the home care industry is comprised of both for-profit and nonprofit home care agencies, these community-based organizations serve distinct roles. They serve their neighborhoods with culturally competent care and offer many important wraparound services and programs beyond home care, including early childhood education, youth development programs, adult literacy classes, senior centers, and more. And recently, as you just heard, our settlement house members joined together as a broader coalition of New York City-based nonprofit providers, forming the community-based home care working group to be able to speak with a louder advocacy voice and develop new partnerships and models of care. For years, these organizations have been advocating together on behalf of the home care sector, trying to reform a system that is in crisis. Home care workers had a median pay of $28,750 in 2020, and an estimated 1 in 4 workers were living below the federal poverty line, making them some of the most economically disadvantaged employees in the state. With these poverty level wages and a growing workforce shortage, we need urgent interventions. And for too long, state mandated funding and reimbursement policies through Medicaid have unfairly pit home care workers and employers against one another, while in reality, they're all on the same team, trying to operate strong programs that serve older and disabled New Yorkers in need, while paying workers fair and sustainable wages. We simply can't sustain a system that's built on poverty, wages, and staff burnout. And fair pay for home care is the way out. The bill, sponsored by Senator May and Assemblymember Gottfried, sets reimbursement rates at 150% of the regional minimum wage, bringing New York City wages up to $22.50 per hour. And crucially for the nonprofit providers, it sets Medicaid rates, so providers are paid appropriately for those wages. A recent report from the CUNY School of Labor and Urban Studies found that this legislation would create 20,000 additional home care jobs per year for the next decade and result in net economic gain of billions of dollars for the state. And it really needs to happen through the budget process so that it's fully funded. As we know, Governor Hochul's executive budget did not include the bill, but did include the one-time bonus for home care workers. This is not at all sufficient to meet the challenge. We're really glad that the Senate and Assembly included it in their one House budget bills last week. And the state is in a very strong financial position. So we do have a lot of momentum as we move toward the April 1st deadline. This resolution really sends a message that New York City is on board. So we thank you again. Urge the council to vote in favor of this resolution. And I've submitted some written testimony that has more background on state of the workforce and the importance of this bill. We also have some additional recommendations on reforming the home care industry, including looking at the State Department of Labor's 13-hour rule for 13 hours of pay for 24 hours of work. There's a lot that the city could do, as Wayne just mentioned, to look at career ladders and training, particularly with HRA. So we'd be happy to follow up with anyone who's interested. Thank you for your time.
Thank you for your testimony. Now I'd like to call on the last witness for this panel, Lorraine Sullivan. Your timer starts as soon as the sergeant cues you.
Lorraine Sullivan, your clock is ready.
Good morning, everyone. Thank you, Chair Del Rosa and all council members for this opportunity to provide our testimony. I'm the Director of Human Resources at Rain Home Attendant Services. And Rain Home Attendant Services has been advocating for fair pay for home health aides along with 1199 SEIU. We recognize their compassionate and quality work delivered that is critical to help maintain our valuable members in the community. Home health aides are the backbone of our medically fragile of all ages, and we call upon our elected officials to elevate the conversation and help us affect change in their compensation. Home health aides are truly doing God's work, and they are the angels on the ground. Because of them, many of us can go to work and engage in the routines of our daily life. We all have a story to share, and in one way or another, regarding a loved one and the risk that they run daily. Having someone providing a professional service should be compensated and supported in their work life. Professional recognition is also much needed in the home health industry. We must not forget that these home health aides represent our community and as such run the risk of medical complications as well. Fair pay will enable them to make ends meet, pay for copays of medications, and adjust the cost of living increases. Thank you. Respectfully submitted, Dr. Anderson Torres, our President and CEO. Thank you.
Thank you. I will now, thank you for your testimony. I will now turn it over to Chair De La Rosa for questions for this panel.
Thank you so much. And I want to recognize that we've been joined by Councilmember Menon as well. So I do have a question about the minimum, how this bill in the state legislature would raise the minimum wage. And so if passed, the Fair Pay for Home Care Act would raise the minimum wage floor to between $19.80 an hour to $22.50 an hour for home care workers employed in New York. Do you all feel that this fair wage is a fair wage rate for New York?
Can I respond even though it wasn't my panel or?
Sure.
Okay, I'm sorry. And if anyone else does want to. I just quickly, two things. One is it's a floor. It's not a ceiling. So if $11.99 negotiates a higher hourly wage, there's nothing to stop that. Two, what I think the beauty of this is that it sets in statute that home care workers will get 150% of the regional minimum wage. So it remains there. And what's happened over the past decade, and many folks who have testified today can attest to, is that because a lack of Medicaid funding and basically really care for this workforce was neglected for a decade or more, that's why we're in this position. This would set in statute a floor to move up from.
Thank you, Bobby. And my next question is for Wayne. Wayne, thank you for being here and for all of your work. Besides the low wages, what are some other issues you find as a provider that are affecting the New York home care workers?
Yeah, I mean, wages are the #1 driver of our challenges right now. We know that there are home care workers who are doing hard jobs and they're not getting compensated fairly for how tough the job is. But we also do know, and I do want to acknowledge Edwin for mentioning it, is that during the pandemic, it was a very tough time where they were classified as essential workers, but the state of New York, for example, did not prioritize them for PPE, did not prioritize them in vaccinations, did not prioritize them for hazard pay. And that's why many of us as providers and advocates did advocate in trying to get those from the state level. We know that many of them risk their health and risk their family's health to go in and work at this time. And while we're happy that there's vaccinations, we still get reports from our workers who might have caught a variant, or they have family members who caught variants and they can't go into work. We also still have clients who do not want home care workers coming into their homes during this time because of the pandemic. Clients are obviously frail and vulnerable, so they're worried about their health. So they're moving towards the consumer directed program for home care, where a family member who lives with them can take care of them, as opposed to a traditional home care worker. So I do think that in addition to wages, the continued pandemic still is a priority that everyone's trying to address.
Thank you so much. And I want to open to see if any of the colleagues have questions as well.
Sure. I will now call on council members in the order you have raised the Zoom hand function. I see council member Nurse has raised her hand. We'll send you an unmute request and you can go ahead when the sergeant starts your clock.
Councilmember Nurse, your clock is ready.
Thank you. I don't have anything profound to say. I just want to express my support for the workers here and the healthcare workers who are demanding to be paid better. And I just want to express that we're all with you. And I know that many of the council members have y'all's back in ways we can support. I wish we could do more beyond just resolutions and expressions of support, but really actually be able to deliver for you all. But I appreciate your time here. And I just want to say we're all with you and we stand with you and we're doing what we can. So thank you for being here. And thank you, Chair.
Thank you, council member. I'll give a chance to raise hands if any other council members have questions for this panel. Not seeing any hands. We will now turn to the next panel for questions. For testimony. The next panel, I would like to now welcome Caitlin Andrews, and followed by MJ Okama. Caitlin, you may begin when the sergeant starts your clock.
Caitlin, your clock is ready.
Everyone, thank you for the opportunity to testify today. My name is Caitlin Andrews. I'm the Director of Public Policy at Live On New York. Live On New York's members include more than 100 community-based nonprofits, some of which you've heard here today, CPC and RAIN, and then MJ will be testifying for SAGE. Following this are members who provide community services for older adults as we age. These include older adult centers, home delivered meals, and of course, home care. Live On New York is strongly in support of Resolution 0024, and of course, we want to thank Councilmember Hudson for her introduction of this resolution and leadership in bringing this to the City Council. In addition, we thank Chair De La Rosa for your support and holding this hearing today, as well as the more than 20 council co-sponsors who have already signed on in support of this resolution. Thank you. As has been highlighted today, according to PHI, nearly 90% of direct care workers are women, 3 in 5 are people of color, and 1 in 4 are immigrants. Unfortunately, 1 in 7 low-wage workers in New York City are home care workers, leading to more than 50% of this workforce relying on public assistance to make ends meet. This, as a result of government-sanctioned wages, demonstrates the fact that the undervaluing of home care workers is one of the more pressing equity issues facing our state. We just had Women's Equal Pay Day, symbolizing how far into the year a woman must work to make the same as their male counterparts in the previous year. We can no longer just acknowledge this injustice during one day, but we must dismantle the systemic realities such as the undervaluing of home care workers that create these inequities. As a result of the underfunding, the home care sector is also understaffed, and altogether it has been found that New York State now has the worst in the nation home care shortage. Through fair pay for home care, New York has the opportunity to go from worse than the nation to leading the nation in creating the caring economy that we all deserve. Now, I will just add that fair pay is just the beginning. We need to begin to value all of our care workers. Here are just a few ways that the city can directly support our care infrastructure. On the city level, the city also needs to just pay our human services workers who are also care workers in their own right. That means a COLA in this year's budget, a minimum of $21 an hour, and the creation of a comprehensive wage scale. Just like their home care counterparts, so many of these city home care or human services workers are also receiving low wages and are relying on public assistance just to get by. Next, we need to fund the Department for the Aging. In this, we're asking for $5 million to address waiting lists for case management, which screens individuals for home care. $12.7 million for home delivered meals, which help older adults to remain fed when living in community. And finally, $28 million for home care on the city level to expand hours and address waiting lists. And finally, back to the topic at hand, pass this resolution. This is a strong show of support from the City Council to your state counterparts that we need fair pay this year in this budget. Thank you.
Thank you. I will now turn it over to MJ Okama for your public testimony. You may begin when the sergeant starts the clock.
MJ, your clock is ready.
Good morning. My name is MJ Okuma with SAGE, the country's first and largest organization dedicated to improving the lives of LGBTQ+ and HIV-affected older people. We provide social services and community building programs through a network of 6 older adult centers across the city. SAGE is also proud in our role as an on-site service provider at New York City's first LGBTQ+ welcoming elder housing developments located in Brooklyn and the Bronx. I'm here today in strong support of Reso 0024 in the Fair Pay for Home Care Act. Nearly 1/3 of LGBTQ+ New Yorkers are over the age of 50, and this rapid growing population experiences greater disparities in both physical and behavioral health outcomes due to the effects of bias and discrimination and the impact of the resulting chronic stress on their health. On top of that, distrust in health and social services due to a fear of continued discrimination can lead LGBTQ+ older people to delay seeking needed care and result in premature institutionalization in nursing homes and long-term care facilities. Many of those fears are exaggerated for trans elders and older New Yorkers living with HIV who face additional fears of stigma and privacy concerns. Home care is vital for LGBTQ+ elders to help preserve their independence and access to community and chosen family. However, the high turnover and vacancy rates in the home care field hinders not only access to these services, but also the ability to build the trust needed to break down these barriers between LGBTQ+ elders and home care services. New York is currently facing a labor shortfall of home care workers, while those in the field are severely undercompensated and just plain exhausted. Meanwhile, the aging population whose interest in supports to age in place is growing, creating an even higher demand for home care. This growth coincides with an increase of LGBTQ+ elders who experience increased rates of disability, poor physical health, and HIV. To quickly go over some of the numbers, more than half of people living with HIV in New York State are over the age of 50. LGBTQ+ elders are nearly 20% more likely to report high rates of frequent poor physical health. And transgender New Yorkers of all ages are 50% more likely to report being in poor physical health than their cisgender peers. Fair pay for home care is necessary for both the givers and receivers of care. We must end the unacceptable poverty wages for home care workers, an essential workforce which is 90% women, 67% immigrants, and 75% women of color. Investing in this workforce would not only advance racial and gender equity, it would eliminate the home care labor shortage and help increase access to LGBTQ+ competent care and keep LGBTQ+ elders in their communities as they age. SAGE stands in strong support of Reso 0024 and the Fair Pay for Home Care Act. Thank you so much, Chair De La Rosa, for holding this important hearing, Councilmember Hudson for championing this resolution, and for all the co-sponsors of this resolution. Thank you so much for your time and this opportunity.
Thank you, MJ. I'm going to turn it over to the chair for questions for this panel.
Well, first, I want to thank you both for your powerful testimony. I know that Live on New York has been advocating in Albany for what feels like decades for this to be a reality. So I want to thank you for your work. And SAGE, thank you for bringing the plight of LGBTQ+ elders to the forefront. A portion of our communities that seems to somehow continues to be left behind. So thank you so much for highlighting that. I do have a question, and it's regarding the investment in home care industry. So you mentioned just pay, which is a separate topic, but related because it's the same type of workers that are subjected to these poverty wages. Can you both explain from your experiences what a public investment in these industries will mean to benefit our city and our state's economy as a whole?
Sure, I can start. I think for both home care workers and human services workers, these are individuals that live in our communities, that shop locally, that have strong roots in the neighborhoods that we all know and love. And unfortunately, there are individuals who are unsure if they can continue to live in a high-cost city like this when they're not receiving the wages that they deserve. We need to be funding all care workers, home care, human services workers, child care in the way that's deserved so that they can continue to live in New York City and contribute to our communities and support those who need it. Unfortunately, we have we don't have a consistent COLA in the budget for human services workers. We don't have a minimum wage floor for human services workers or for home care workers. These are all sort of minimum steps that could be taken to ensure that the floor is solid. And ideally, we go above that and we start to invest in the way that these workers truly deserve. But that floor is so shaky right now that it's leading to people living in homeless shelters or contemplating having to move out of this high cost state. And certainly on the adverse side, it's leading to older adults and people with disabilities not receiving the care that they need. There was a story recently in testimony of an older adult who was told she only has a few more weeks to live. And her biggest fear right now is that she's going to have to spend those in a nursing home because she just can't find the home care attendants that she needs. The impact is on every side of the spectrum. And I think we all know it and see it. And you've seen your family members cobble together the support that's needed, but that's not sustainable long-term.
Yeah. I would kind of add to that, SAGE is a strong supporter of the Just Pay campaign as well, in like increasing the wages for all human services workers. And, this is a labor issue. It's a fact of valuing essential workers, valuing the folks who've been on the front lines for COVID and who've been doing this work and being severely underpaid for it for decades. But, really highlighting again, it's also about the clients and people who receive care under these services. Specifically, we see with LGBTQ plus populations, there is a lot of distrust because of, long histories of discrimination in both healthcare and social services that these elders have faced. And if your home care if the person you're seeking services from is constantly turning over because of these low wage workers, that's going to stop people who are in most need from trusting and accessing these services and building the supports and trust that they need to make sure that they're connected to everything that they need to age in place. So I think that's another side of this. On the economic impact, I do want to highlight that there is a March 2021 report from CUNY that said that the Fair Pay for Home Care Act would net over $3.6 billion for the state. And it kind of outlines where all that money would come from. That's linked in my written testimony as well. But there has been a study that said that this would bring substantial gains to the state budget.
Thank you so much. I also want to recognize that we have been joined by both Councilmember Joseph and Councilmember Farias. Thank you both for joining. Elizabeth.
Sure. Thank you, Chair. I will now call on council members for questions. I see that Councilmember Felice has raised his hand. You may begin when the sergeant starts the clock.
Councilmember, your clock is ready.
Thank you so much. Good morning, everyone. Thank you, Chairwoman Carmen de la Rosa, for this hearing. Also, thank you, Councilmember Crystal Hudson, for this very important resolution. And also, thank you to all of you, everyone who's participating this morning, for making your stories and your voices heard. I grew up in an underprivileged section of the Bronx. My mom was a home attendant. Many family members of mine were home attendants. Many neighbors of mine were also home attendants. And I saw what we all know, which is that home health aides work very hard. They work hard, sometimes every single day, sometimes 7 days a week, at all hours of the day and all hours of the night. And their work isn't easy. Home care workers have had the backs of our vulnerable populations, including our elderly. And I just wanted to briefly say that just like you support our vulnerable populations, I, as council member, will be working with all my colleagues to support you for fair and just pay. And I thank all of you for joining this one. Thank you so much.
Thank you, council member. If any other council members have questions for this panel, please use the raise hand function in Zoom. Seeing no hands, that was actually our last panel. So I would like to do a last call. If we've inadvertently missed anyone that is registered to testify today and has yet to be called on, please use the Zoom raise hand function now and you will be called on in the order that your hand has been raised. Okay, seeing none, I will turn it over now to Chair De La Rosa for closing remarks. Chair.
Thank you so much. And thank you all for coming, for sharing your lived experiences, your work experiences, and to my colleagues for their thoughtful questions and comments. We have an opportunity before us, an opportunity to influence what our colleagues in the state legislature undertake in the next few weeks. As we all know, budgets are moral documents about what we prioritize as a society. And as the chair of Civil Service and Labor, I am proud that this is the first piece of legislation that is coming through the committee. It is a promise and a commitment to the workers of New York to make sure that poverty wages no longer exist in a city that is so divided by the wage gap, by the wealth gap. And so I am honored to work with Councilmember Crystal Hudson. I thank her for her leadership, for bringing her pain and experiences to bring the solution forth before the city council. And again, thank you all for being here, and we look forward to making sure that this resolution is passed as a symbol of the city council's commitment to these immigrant, mostly women, workers in our city who have kept our state and city afloat in its darkest hours and now deserve to be compensated fairly, to have benefits, and to have a caring economy, as Bobby so eloquently always reminds us. So thank you all for being here, and I look forward to seeing this pass. Thank you.
Thank you, Chair. If you could just gavel out and then we'll close. Thank you, everyone.